Everybody knows me by Dr. T.
Okay, Dr. T, say your name again, though.
Lorenzo.
Lorenzo?
Yeah. Telleria.
Okay. Valeria.
Telleria.
Okay, so Dr.
We're not
T.
going to butcher his name. We're just going to call him Dr. T.
Dr. T.
Dr. T is absolutely great with me.
Okay.
So that's how you got the name Dr. T.
Yeah, absolutely.
Okay.
Yeah.
And tell us your profession, what it is your profession is at the clinic.
Yeah, I am an infectious disease doctor.
Okay.
So basically what I do on a daily basis is, I diagnose and I inquire about and I treat and follow up infectious diseases.
Right.
Now, when infectious diseases have many different facets, right? So bacteria, any kind of bacteria anywhere in the body, that is an infectious disease.
Right.
So that's one of the things that, we can treat and check you out, urinary tract infections, skin infections, eye infections, nose infections, ear infections, infections in your lungs, infections in your kidneys, infections in your liver, infections in your GI system, infections anywhere. Right. In the bacterial infections, sometimes the STDs are there too, right? Chlamydia and gonorrhea and whatnot, and syphilis and so on and so forth.
Yes, sir.
So then we also diagnose and treat diseases that are caused by viral particles.
Yes,
so
sir.
These are like influenza, right? And RSV, for example, and COVID, and hepatitis A, hepatitis B, hepatitis C, HIV, and so on and so forth. We can also take care of fungal infections, like problems in your feet, vaginal kind of candidiasis, or yeast infections. So that's what we call fungal is yeast. But there is another category of yeast infections that are not really yeast, they are different, and they can affect your whole body. They can affect your lungs, your brain, etc. And then we also have parasitic infections, right? The different kind of worms that you can have in your GI tract or in different places of your body. So we call them elements, and so on and so forth. So it is, and there is more. But that's just trying to make it short.
Right. So let me tell you, I have a 30-year-old son, and he has cerebral palsy, and he has seizures. I have took him to an infectious disease doctor many times, but I haven't. I knew some things, and I think it had to do with some type of infection behind something like he has a G-tube.
Okay.
So there's many different things that can get him in a state where he has to go see an infectious disease. What are the more reasons that it would be for, let's say, a handicapped child?
Yeah. Well, first of all, if they have problems with mobility, right, they can have in the areas where there is a lot of pressure because they don't move as much, they can get ulcers. So those are called the cubitus ulcers because it's in pressure areas, and those things, they start like a little scar in your skin, and then it gets deep, so it becomes an ulcer and it gets infected.
Right.
So that's one kind of things that could happen, to people who are mobility impaired and have difficulty understanding that they do need to move from one side to the other. Right. Also, in a case like in your particular case, in your child's case, depending on the degree of cerebral palsy, they may need, like you said in your case, a feeding tube.
Right.
So when you have a feeding tube, first you have to put it in, and that is a procedure. Right. And, things can happen during and after the procedure. Right. Because that is a wet environment. Right. When you're injecting him the food through that tube, the food goes through the stomach, but sometimes it just stays around and you have to keep it dry. You can imagine how that is a
Yes, open.
Yes, it's open. It's always open.
Right, it's always open.
So you can imagine how many infections can get there because the bacteria thrive in that environment, right? 37, 96 degrees.
Right.
Perfect temperature for bacteria. Wet, perfect for bacteria, etc. So, so that can happen, and that's something that we can take care of in association with a GI doctor because it may have to come out while we treat it, right?
Yes, sir.
And some other problems can happen too, like urinary tract infections if they have a catheter, right? Or if they use diapers, they can have diaper rashes. They can have diaper problems associated with their skin. Those are all kind of skin problems. All right. They can also have, if they have seizures, like you said. Right? Seizures can bring their own host of problems. Like if they vomit, right? That vomit, while they're having a seizure, that can go into their lungs.
Right.
And that will become a pneumonia. So at the beginning, it can be treated as an outpatient, and it should be, but as it progresses, it's a bacterial infection normally because of the contents of the esophagus. And that needs to be treated in a hospital. Right? And so on and so forth. So, but we can absolutely take care of some of those problems depending on the acuity, right? Because sometimes due to the specific nature of those kids or those people, they need a little more comprehensive treatment, like, in a place where they can be moved every day and taken care of, in every aspect, not just one problem.
Right. So we want to welcome in our executive director to the show.
Very late, executive director.
That's okay. Better late than never.
Amen.
So we were talking with Dr. T, Mom, and I was telling him about my son's condition.
Right.
And he was just explaining why, because I told him, I have had to take my son many times. So he was basically saying that open area where the G tube lays,
right,
can create it's room to, if it's not very, very clean, there's many bacteria issues that can happen in that situation with that G tube sitting there and that just being open. And he was just giving us a lot of examples for that.
And there's even more, because depending on how good you can feed them or not, they may become weakened or in a weakened state, which will weaken their immune system.
Right.
And then they will need, a whole host of vaccinations at different times that perhaps an adult will. And they will have, so it is a complex care.
Right.
But it is different, like a person without that kind of disabling problem.
Yes, absolutely.
Okay.
Absolutely.
Well, one of the things I would like to say, and when we talk about infectious disease, that is just like you're saying. I was listening on the way in. It's just such a lot of things, and so what for Dr. T, and I call him Dr. T because there's absolutely no way in the world I can pronounce his name. And so, so as
we already slaughtered him in 5 minutes.
Okay, so
literally.
So when I first met Dr. T and he told me this long name, I said, that's not gonna work. So I said, okay, I'm gonna call you Dr. T, and by the grace of God, he was gracious enough to allow me to do that. But talk about what you do at Florida Community Health Centers, because I think that's very important. Of what you do at Florida Community Health Centers surrounding the care of our community.
Yes, obviously there are some problems that we see much more often than others.
Right.
So, let's start a common, what would be a common day for me, right? I will have some people that go there because they are aware of the existence of some medications, so they don't get HIV if they can be exposed to it, right? So that's called PrEP. So I may have 1 or 2 patients that will go, so I'll check and we'll talk about how their lives been for the last 90 days.
So let's talk about PrEP, because I am really into prevention. That's one of my biggest things. I believe that when I was a child growing up, they say an ounce of prevention is worth more than a pound of care. And so I believe in prevention. And when we talk about PrEP, we're talking about PrEP in the way to prevent HIV. We understand that HIV is a disease that can be prevented. That's number one. And number two is knowing how to prevent that disease. And so many times, we talk about it, but not understanding that because of behaviors, because of different things, people put themselves at risk for HIV.
Yes. We
understand that HIV can only begin through someone, first of all, who has HIV.
Infected, yes.
Okay. And then through unprotected sex, becoming in contact with body fluids. I learned recently that when we talk about breastfeeding, that if mom is taking a medication like she needs to, that breastfeeding is no longer an issue, which, that's really good. So understanding how HIV is transmitted is key, number one. Number two is understanding that, how I put myself at risk for this disease most of the time is through IV drug use. Mm-hmm. So through shooting up, and then also through my sexual behavior. And now we have this medication, and we put that will prevent HIV, and we call PrEP. So talk to us a little bit more about that, and then also how important it is to get HIV tested, number one.
It is extremely important because if let me put it this way, right? If you're a person that has used any kind of drugs and you have ever shared a needle, of course it has to be shared with somebody who's HIV positive, right. But that's a common way of acquiring HIV.
And I just want to put a note on that, Dr. T. If you are shooting up, and we know how it goes. We don't want to go into it because we don't want to cause no triggers to anybody who is in recovery. But you know how it goes. You're actually putting this disease exactly where it needs to go.
Yeah, just like Hep C, right?
Yeah, just like Hep C.
Yeah, and but also people who are sexually active and may have more than one partner, and they just don't know whether the partner what's the HIV status of their partner.
Right.
Not everybody asks that, even in a normal relationship, sometimes it should be asked.
Well, I just want you to know that's a buzzkill, Doc.
It is?
In that moment,
It is,
where all that emotion and all that stuff going on. I'm going to ask, baby, when the last time you got tested?
But you're starting from the principle that's happening before they know each other.
Right.
Yeah, so like a Friday night special or something like that.
That was just a Friday night special.
Not a Friday night special.
Well, that happens too, right?
Yeah, it does. It does, Dr. T.
And in that case, people are not going to ask those questions.
Right.
In that case, it doesn't matter if this is a man that's having sex with a man that's having sex with a woman that's having sex with a woman. That really is not a good differentiator.
Right.
It's just the fact that there's going to be sex and there's going to be exchange of fluids of some sort, right?
Fluids going to be exchanged, Dr. T. I just want
fluids
you to know.
are going to be, yes. Fluids are going to be exchanged, and that by itself is a risk.
Right.
Right there, right then. Mm-hmm. At that moment, you're exposed to a risk.
Yes.
Right? Of course, HIV is one of them. Hepatitis B is another one of them.
Don't forget about syphilis, because syphilis is on the rise in our community. I'm just going to put that out there. Right.
Chlamydia,
gonorrhea.
And some others.
Right.
So life happens.
Right.
And there is a lot of young people
old people too, Dr.
And old people too, everybody. But they don't think about that once you get HIV, you're not going to get cured. So far, we cannot cure it, right? So PrEP is a medication that you take because you want. This is something very important. I want people to understand this. Like, for example, if you know you're at risk, or you may become at risk, or you're sexually active, all right? That's it.
And you don't want to wear condoms.
And well, that's even worse.
That part.
But yes.
Yeah, that part.
Yes, that part. But then you have the ability to know and to prevent yourself from getting HIV, which is not curable, by taking a medication that you take because you want to, not because you have to. So, and the distinction I'm making is because once you have HIV and you have the disease, you have to take it. Otherwise, the disease is going to get you.
Right.
But when you're using it as PrEP, it's your election. It's you grabbing that bull by the horns and saying, I'm taking responsibility for my sexual.
I'm in control.
For my sexual.
Say it again, Lee.
I'm in control.
I'm in control. Right.
I'm in control. Nobody else is going to control me. If we don't do it by ourselves, nobody's going to do that for us.
That's right.
Right? Nobody's going to, if you're out and there are people outside that they don't even know they have HIV because they've never been tested. Again, going back to the initial question. So they're not going to tell you they have something. They just don't know. Right? And that's how it stays in the community. That's how it progresses in the community. Right? Because there is a lot of stigma about it also.
Yeah,
right? People don't like to talk about it, just like we're talking
right
about it. But it's something that people should be talking about. I always say, listen, you cannot, you cannot, how do you call that? The sun with a finger. You cannot obliterate the sun with one finger. Right. Somehow. HIV doesn't care. Yeah. HIV doesn't care.
Right.
HIV, what is the job of the virus?
That's
the
right.
The job of that virus is getting to a human being.
Right.
Right? And live there comfortable as long as it can, and in the process try to get into another human being so it can survive.
Right.
That is the virus. The virus don't care the color of your skin.
Yeah. Say that.
The virus, it doesn't care.
It doesn't care.
It doesn't care whether you are
rich, poor.
Rich or poor. It doesn't care.
I want to jump in. I want to jump in on that as well. But before I add my comment, I want to ask the listeners if we could get them to call in. The reason of the show, another part of the reason of the show is to receive calls. So we are asking anyone, and you will remain anonymous, to call us in. And if you have a question for the doctor, the number is 772, that's here locally, 278-8651. Again, 278-8651. Go ahead and give us a call up to ask the doctor. Hold on, I just jumped away. Let me let it come back. Why is it so important to know? Because people are afraid to know their status. Mm-hmm. Tell me, why is it important for the people to know what their status is?
Well, if you don't know your status, you cannot do anything about it until the disease manifests itself. It's not that you're going to be.
How long does that take?
That can take anywhere between 6 to 12 years after you are infected. So for 6 to 12 years, you may not even know it, but the disease is progressing inside of you. Mm-hmm. The disease is killing some very important cells in your immune body that after a certain point, you cannot bring them back. Mm-hmm. So, and as that happens, your immunity wanes and goes down. And once you get sick with what we call AIDS-defining illnesses, that means that, and normally that's when somebody will come to a doctor, I'm having this or this problem. The doctor will say, oh my God, let's do an HIV test. Because and when it comes back positive, and they see the levels of the virus and the levels of their CD4s, they say, oh my God, not only are HIV positive, you have AIDS.
So that means they're past the HIV status.
They still have HIV, but they're past the status where now they're going to have a lot of problems, and they're going to see it, and they're going to experience cancers. They're going to have different types of skin infections. They're going to have eye infections. They're going to have infections in their brains. They can have infections in their lungs. They have it's just a whole host of problems, and then after that, death.
Right. One of the things you said though, and I really want to make sure we clarify this, is that you can have HIV up to 10 to 12 years and not know it. That doesn't, only way you don't know it is because you never got tested.
Of course.
This is the importance of getting that HIV test.
Right.
You know, Lee asked the question, you know, about the fear of it. And I heard it said in the early days, because I've been doing this for a number of years, that it's better not to know. Well, first of all, it's better for you to know so you don't give it to someone else. It is the key behind that. And you cannot treat what you do not diagnose.
That's one of the reasons.
There is a key. You cannot treat what is not diagnosed.
Right.
And so this is the importance of going to Florida Community Health Centers, calling in the Image of Christ, reaching out to a facility within your own community to get that baseline, to get the HIV test. And I have a friend, and I'm going to call her name Janet Kitchen, who says everybody's at risk for HIV. I don't care who you are at risk for HIV.
Right.
And therefore, you need to get an HIV test. If you are sexually active or have been sexually active, you need to get an HIV test
you know what?
so that you can know what your status is, because you cannot protect what you do not know.
Absolutely.
And
You
then
know what, Mom?
If you get tested because you're somehow worried about it, it's because also you are at risk. And if
Right.
you are at risk, then that's the moment when you say, you know what, I'm going to protect myself. I'm going to use PrEP. You
Right.
know what? Normally, what we know as PrEP is a pill that you
Right.
take on a daily basis.
Right.
That it has some of the components, not all of the components, that an HIV pill would have. But normally, they don't have any side effects or very, very small GI side effects, mostly the first week. After that, you don't even notice you're taking anything. It's like a vitamin.
Well, I think it's important, and if you can't tell, I'm an African American female, but I think it's very important for us to talk about that, because in the early years, and it has changed in Area 15, and that's inclusive of Martin, St. Lucie, Okeechobee, and in River County, 1 in 35 blacks was infected with HIV. 1 in 35 black females. And so this is, once again, making a choice that I'm going to protect myself. I may be in an abusive relationship and choose to be in that and not knowing how to come out. And that also puts me at risk. It may not be that I'm having sex with 5 or 6 different men. It just may be I'm in a relationship that is unhealthy. But I now can make a choice that I don't get HIV. I can go to the physician. I can go to the clinic. I can go to wherever I need to go, and I can get put on PrEP. It is one pill to make sure that I am protecting myself from a disease. And I want to say this again, and we've been saying it for the last however many years it's been now, that HIV is 100% preventable.
Absolutely.
But it takes us as humans to be able to do that. And I'm so grateful for you, Dr. T, being in our community and working with Florida Community Health Centers, because if I have money, I can go. If I don't have money, I can go. If I have insurance, I can go. If I don't have insurance, I can go. So it takes away all of those barriers that would stop me from protecting myself.
Right.
It really does. And
Yes.
and also understanding that that I am important, that I can make that choice so that I don't have to get HIV.
I think I have a caller, Mom.
Well, I'm going to keep talking to you, answer.
Okay.
I can make that choice, and I think that's very important. It empowers us as individuals,
Yes.
not to be a victim, but make a decision that I'm going to protect myself.
Absolutely
Amen,
empowering.
amen.
Just knowing that you will not get sick with such a disease.
Right.
Let me interrupt and see if our caller is with us. Hello, good morning. Good afternoon. This is WJGW with Ask the Doctor.
Yes, can you tell me, is the shot for PrEP just more as effective as the pill?
Yes, it is.
I heard the question.
Yes, it is as effective as the pill, or even more, because you don't forget to take the pill, or you don't leave the pills behind when you go traveling, so it is just as effective, and it's one injection every 8 weeks. So it's extremely effective.
So that's what, every 2 months?
So that's every 2 months, and there is one that hopefully it will be soon. I would say 1 or 2 years from here. That's going to be every 6 months instead of every 2 months. Just imagine that.
Wow,
Yes.
I think that's really good, and you hit a point. Those, because I know people who cannot swallow a pill, and so taking that injection is important. And also, I know people who don't know, who forget to take pills.
Did we ask your question?
Yes.
Do you have another question, caller? I guess not.
Okay. You know what I wanted to ask? After, see, the reason why I asked that question is because when you find out you have HIV, what medicine do they have, and how does it help you to cope with once you are positive?
Yeah, well, once you know you're positive, especially if you found that you were positive through a screening test, so that's when you go and you want to test. The good thing about it at that point is that your immune system is still very strong, that everything is preserved. So basically what you're going to be doing is taking one pill that's going to make that virus go away from your blood. It's no longer going to be in your blood. Mm-hmm. The problem with HIV is that it hides in certain parts of your body where we cannot reach it.
Right.
All right, like the lymph nodes and the spleen and so on and so forth. And it is a very complicated disease when we go to the nitty-gritty. But when you're taking the medications, basically it's no longer in your blood. Right, so it's only those places where it hides. So another amazing thing about the medication is that if it's not in your blood, it's no longer causing your immune system to decline.
Right.
But also, while you're taking that medication, you cannot pass the disease to anybody else. Can
you just say that again?
When you're taking your medication, you cannot pass the disease to anybody else. Undetectable, which is no virus, means untransmissible.
Right.
That you cannot transmit it.
Right.
That is, so you're protecting your community, you're protecting your family, you're protecting your friends, you're protecting your lovers, you're protecting everybody as well as yourself.
I think that's a key factor that we needed to hear.
I think that's a key factor, and it's one that in the beginning, because I've been in this field for a long time, we didn't that wasn't the way that it was.
Right.
And so understanding that the way we end the spread of this disease, number one is prevention, which we're talking about PrEP and the importance of us as individuals who are putting that are at risk to take PrEP, and the other one is for people who are already infected with HIV, for them to take their medication on a regular basis. And I think maybe next month or so, Dr. T, if you agree with me, you can come back next month. We'll talk with Dr. Lewis about that, but also have people in the room who are HIV positive, so that who are willing to share their story, because in the beginning of this disease, it carries such stigma and such fear and such shame, and yet nowadays you can walk past that. You know what I'm saying? You really can, and to be able to do that. So, but it's important for those who are infected,
yes,
who have HIV, or the diagnosis of AIDS, how important you are to us.
Right.
Because, and then I say that because if you take your medication on a regular basis, like Dr. T said, you cannot transmit this disease to anyone else.
That's powerful.
That is powerful.
That's powerful. I believe that if people that are afraid of the virus and so on, if they knew that, I knew that people would get tested more.
Right.
Because at that point, like Dr. T was saying earlier, I'm taking control. So now I'm not spreading. Go ahead, Dr.
Exactly. T. Well, it's like, and not only that, but they will live a healthy and productive life. They don't have to be thinking, oh my God, I have this disease. What's going to happen? What about the future? What? No, you're doing something about it. You're taking care of yourself also. But that's the beauty of prevention, because at that point, you're doing it because you choose to do it, because you're doing yourself a favor and you're doing your community a favor, but not becoming infected.
Right.
Then also, of course, once you're infected, taking care of it by knowing. It's so important to know. You cannot fix something like you were saying that you don't know about. And preventing this thing from getting, complicated, because it will.
It will.
And that's what happened in the past.
It will.
That's how all this stigma became around HIV, because in the old days, it was a death sentence.
It was.
We didn't have the medication. It was very difficult to come with the medications. But nowadays, you remember those days when people had to take 20, 25 pills in a day just to treat?
I remember.
Those in the 90s, that's not too long ago.
Hold on, caller, one second. We have another caller. All right, WJGW, you are listening to Ask the Doctor, and you are on live. Do you have a question for us today?
Yes, so my question today is, how quickly do people who are infected with HIV develop AIDS?
Yes, it depends greatly between individuals. So when I was saying earlier that it takes between 6 and 12 years, that's what we normally see in the general population. But when I say that, I'm probably just talking about 90% of the population. So some people will develop it before the 6 years, and some people will develop it after 12 years. So those are the numbers we go by. Because that's what we have seen over the 40 years that we've had HIV amongst us.
Also, caller, it's based on lifestyle as well. It really is based on lifestyle as well. Mm-hmm. You may already have a primary illness like diabetes or a cancer, and so your immune system is already weakened, so it could move faster that way. Also, you could have a lifestyle where maybe you're in addiction, where you don't take care of yourself that well, you don't eat that well, and it can also move rapidly that way. So it's really based on the individual, the type of lifestyle that they live, that how fast this can progress. And I just want to mention while you're on the call, caller, is that, I've known people with HIV for 17 plus years and have never developed AIDS, but they also were people who took care of themselves. They were people who took their medication like they were supposed to. So it's really based on the individual and the type of lifestyle.
I have individuals that have been taking antiretrovirals now for 30 years. And
30 years,
yes, amazing. I have people who are 90 years old. I do. And I have people who are very young and they're living natural, normal, absolutely normal lives.
Right.
And now we also have the chance to, there is an alternative also for people who cannot take pills, just like for PrEP.
Right.
We can inject, we have an injection that we give you in the office every 8 weeks. And that's it. You just take it every 8 weeks, and you're being treated for HIV. So that is amazing. That wouldn't have crossed my mind 10 years ago.
Mine either.
Yes, absolutely. Yeah.
So so the time it's not something that you can contemporize. It's not something that you can say, all right, I have it now, but I don't want treatment. We used to do that, We used to wait until the people reach certain spot in their disease before treating them.
Right.
Now, all that changed. Now we became wiser, and now we know that a patient should start treating as soon as they know of their. So if you have, the process we go through is like you have a normal HIV test, we call screening test.
Right.
This is a test that kind of separates the people that do not have it from the people that should be really tested. But it's when you have a positive HIV test, it doesn't automatically mean you have HIV.
Right.
That means that we have to do a real HIV test, to put it that way, a different kind of HIV test to really know if you have it or not.
Right.
And
So with that being said, Carl, you asking about AIDS. Do you have any more questions?
No, great information and feedback that I've gotten today.
Thank you so much.
thank you.
Thank you.
So one of the things, because we were going into a different realm, but I wanted to touch on, like you said, Dr. T. So you come into, let's say, in the Image Christ at Florida Community Health Center, and you get an HIV test. And we do that test, and it tells us, we see the 2 lines, and it says that you are reactive. We do not tell you that you're HIV positive. What we tell you is that you have a reactive test, which may indicate that. At that time, what we do is a secondary test. So we would call a confirmatory test, where we would, and most of us draw blood, and then send it off to the lab, and then that's how we get our confirmatory. And so even if you come into the office and we tell you that you have a reactive test, it still doesn't mean that you have HIV. We have to do a confirmatory. And so we like to make that very clear to anybody who walks into the office. Once that confirmatory is done, even though we're doing a confirmatory, my immediate response to anybody that works for In the Image of Christ, we have a phone number that we call. And I said, I need an appointment with Dr. T. And I tell them that this is what we have, because we had that situation where a young lady came in and we did a test on her. It was reactive. Found out that her husband was in the hospital and he had been diagnosed with AIDS because he had not been treated beforehand, and they didn't know. They came from a different country. And so we did the test. I immediately called over, talked with Yanni, and said, look, I don't know how to get in touch with Dr. T, but I need it. So what we're saying is once you get a reactive, we automatically send you to the doctor
to get the second.
And that is very important, because we want to make sure that we get you in care as quick as possible so that you do not go into AIDS, but also so your brain won't not eat you alive,
right,
and keep you out of services.
Right.
We talk about stigma, but there's a lot of self-stigma that goes on as well.
Right.
And so we want to get you into services, because this is not something that you need to fight by yourself. You have a whole team of people that will embrace you to help you walk this walk. And so I got the appointment. Dr. T, nurse that was working with him, got her in. She saw Dr. T. She got on medication and was taken care of, and still being taken care of. This is something that you don't have to be afraid of. You don't have to be afraid of diabetes. You don't have to be afraid of HIV, because this is a disease that is 100% treatable.
Yes.
Right.
And we walk the walk with them.
Say that again, Dr.
We
T.
walk the walk with them.
Amen.
We go all the way.
Yes.
Because we understand that the more involved somebody is and the more they know about, be it diabetes or be it high blood pressure or be it whatever, HIV,
whatever it is
that you have, the more involved you are, the better outcomes you're going to have. Because you should know somebody. The more you know about anything, it's just like that diet. If you know how to eat and how to eat well.
Help me out, Dr. T. Help me out.
Yeah.
The oldest saying is, and I think this was on the cartoon, knowing is half the battle.
Say that.
Yeah,
Say that again.
Knowing is half the battle.
Knowing
I think
is half
that was
the battle.
E-Man.
Knowing is half the battle.
Right.
And that's the key of finding out and knowing what your status is which is very important. And knowing that whenever you go to the doctor, you got to remember that there's a whole privacy act. Nobody's going to talk about what's going on with you, because they want to walk you through this process together. So, and that's important. And again, that number to call if you want to call in is 772, our local number, 772-278-8651, 772-278-8651. If you're calling for toll free, it is 888-7. don't have no glasses on. 7 what, Lee?
782-9854.
Hey.
That was not scripted, y'all.
Yeah, it was not scripted. Definitely.
We are
not
definitely live. We like to acknowledge our listeners. So call us up if you got a question. Just call us up.
And because we only have just a few more minutes,
Right.
just kind of want to wrap this up with Dr. T, because you are infectious disease. Now, we've talked a lot about HIV and a lot about AIDS, and because that's what my heart is. Yeah. It really is. From the beginning, I've been in this field for a very, very long time.
How many years now, Mom?
Oh, God, over 20. And so, over 20 years. You know, I was around when the state started our initiative geared toward Black women called Sister. Mm-hmm. And so, and then doing that to man, right. You know, and those types of things, trying to reach those that look like me, mm-hmm. To inform them more about HIV, because one of the things that took place is that when this disease first was diagnosed, nobody knew what it was, or how you got it, or anything like that. But that's not our story today. No. Our story today Amen. Is that this is a disease that is preventable and also treatable. Yes. Okay, it's preventable and it's treatable, and we want people to be into services in order to be treated. So I'm gonna give you like 3 minutes, Dr. T, to wrap up with a promise that you're gonna come back next month.
I make that promise right now.
Okay, all right. And then we will also ask people who don't mind sharing their status, who are okay in their own skin, to come in and talk about their journey with HIV. We don't want to get stuck on one thing, because infectious disease covers more. And so for those who may have questions, you can always put them into our chat on Facebook Live. And then you can also go to our app that you can download on iOS, which is Apple. Go in and type in 107.5 FM, and you'll see it pop up. And then you can download that app. You can put questions. You can put questions in that app, right, as well as text us on Facebook Live. So we want to just tell you thank you, but I do want Dr. T to kind of wrap it up, and I want to let him know how much I appreciate him for being in our community, yes, and the work that he does within the community. It is so important to be in services, I don't care what your sickness is, mm-hmm, with people who show you that they care. And I've seen that in you, Dr. T, and I do want to say I appreciate that.
Yes.
Thank you. And,
good work.
I love my community. I really would love, just imagine, I sometimes dream about a world or a community where there's no longer HIV and there's
right,
no longer, so wouldn't that be amazing?
Oh, it's going to happen.
And it's going to happen.
Yes.
It is going to happen. And, but in order for it to happen, we have to eliminate the stigma first.
Yes.
Because there shouldn't be one already.
There shouldn't be one.
It's been 40 years. It's another world.
Yes.
Right? Everything has changed. 40 years ago, we didn't have computers.
Right.
We didn't have phones. We didn't have these kind of phones. And so it's another world. So basically at AFCAC, we want everybody to feel at home. It's a home place. We not only take care of these problems that we especially talked today, but we take care of many other problems, as I started with.
Right.
And we also have the lab services right there.
Yes.
We also have the pharmacy right there, which has ADAP and has the special programs. So the medications are way more inexpensive than they would be outside for those who have to have co-pays. And also we have dentists, we have other doctors that do, women care, or general doctors that do everyday medicine, and we have behavioral health, and it's just you can get everything in one place.
Right. Which I think is important. It is the beauty of it, because for so many of us, and I'm going to put myself included in this conversation, You don't want to walk in an office where they're specializing in one thing because you don't want people to know your business. That's what we say.
Yeah, why you in my business?
Why you in my business? And so being able to come into a facility that does do so many things, kind of help also eliminate that stigma and give me that sense of okayness to be able to walk in. But I want to say this too, and please hear my heart and hear it very good, hear it very clearly, is that we want you to take care of you, because if you don't take care of you, nobody else will. You are important. You are important to me. You are important to this community. You are important to your family. And most of all, you're important to God. And yeah, I'm going to talk about him because I love him just like that. And so being able to take care of you. And so if you're in that place and you think that you may be HIV positive, or you're thinking about going on PrEP, you can always call 772-359-9653. That is my personal cell phone number. I'm giving it out because we want to get you into services and to get you the help that you need in order for you to live a healthy and productive life. I have no shame in that. I have none in that whatsoever. You don't have to walk this walk alone. You have people who will walk it with you so that you can be the best version of you that you can possibly be.
Amen.
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 Amen to that, Mama.
And when you help yourself in that way, you're helping God.
That's right.
Yes.
That is so true.
Well, I love the fact that we shared a lot of that information today. And the most important part that stick with me is that, we have another caller. Let's get this last caller before we get out of here. WJGW, you're listening to Ask the Doctor. We have a call on the line. Go ahead, caller, with your question.
Yes, sir. Doctor, I have a question concerning the difference between the window period as it regards to HIV and the incubation period. I've met many people who are under the misconception that they can walk around with this virus for 10 to 12 years testing negative, and I have to define the difference between the 90-day window period as opposed to the incubation period.
Yeah,
can you clarify that?
Yes, of course, and thank you for that question. That is a great question.
Great question. Wonderful.
So the incubation period is the time that takes the virus from the inoculation time until that virus mixes with your DNA and starts replicating itself. And that is a very, very short period of time. That period of time is measured in hours. The time between that happening and you becoming positive in a test, because what we test for is two things. We test for an antigen that is in the outside of the virus, so the virus got to be in blood in order for that to happen. So it has to be replicating in order for that to happen. And we also test for antibodies that your body makes against those antigens. So that is what takes perhaps 30 to 90 days.
And that's your window period. Am I right?
That's the window.
So that's
period.
the window period. So you can come in.
Which means that it's a time where you may have the disease, and even if you test, the test may come back negative. But it's not very common nowadays, because the test nowadays is testing
very
for
sensitive.
two different things. Like I said, not only for antibodies like we did in the past, but also for a specific antigen.
So the incubation period is when the disease can be in the body for up to however many years before that body starts to break down. The window period is those 90 days from when you got exposed until the infection shows up.
Well, the incubation period per se is really, it doesn't exist other than it's just your body is already decaying. It's just you haven't tested it, you don't know it. But that is a period in between when you have HIV and you have AIDS and you're becoming,
Right.
So that is different. Incubation is the time it takes for you to have the disease. So when does that disease becomes one with your cells? It's very fast. Then we have a window period, the time in which a test can be negative and you can still have it. And then we have that time, which is the natural history of the disease, which may take of HIV, which may take up to 6 to 12 years until you have AIDS, which is the next step.
Is that clear, caller?
Yes. The audio is not the best, though.
Oh, I'm sorry.
I'm just being honest. I don't know if everybody was clear or hearing it clearly.
Okay.
It was coming, but I appreciate the breaking down the two definitions.
Thank you so much.
The difference between the two.
Thank you, sir.
Thank you very much for the call.
All right. So I just want to add that I think that this broadcast shared a lot of positive input on the virus itself. With being in general, the most valuable one is that once you find out if that so was the case, that you can get the treatment. And people, look how long Magic Johnson has been living with this virus. Years and years and years. And then on the other flip end of that, like Mom was saying, it's not eating your head up. It's not eating your brain up. It's not wearing you down mentally. If I don't know about anybody else, if I know that, okay, I'm doing something about it, Dr. T was saying earlier, you're taking initiative to take control. And also, you're not spreading it. So just those few things in itself, I'm positive will bring you in a better place than not doing anything.
Well, one thing, it eliminates isolation.
Right.
It eliminates that loneliness and where all of these thoughts are going.
Right.
And so now it puts you in a community of people who are doing something about it.
Yeah, smiles.
So now I'm making a choice of how I live my life, which is very, very important.
Right. Go ahead, Dr. T, and we're going to let you close us out.
All right, just want to thank you both very